Hello and good evening, everyone. I hope you all are doing fine and I'm audible. I hope I'm audible and my voice is loud and clear. Okay. So, welcome to another live session on Idendu, which we are doing exclusively for our NEET MDS aspirants. So, today we are going to discuss mainly the topics from oral pathology and oral medicine. Okay. So, as you all know, oral pathology and oral medicine are two of the very important subjects for your NEET MDS examination. Okay. And these two subjects, that is oral pathology and oral medicine, have like lots of uh, common topics, or you can say overlapping topics. Okay. So that's why we are discussing these two subjects together. Now, today we'll be mainly focusing on the developmental disorders, tongue disorders, and the physical and chemical injuries. Okay. So, for the NEET MDS examinations, you can expect around like 20 to 25 questions just from these oral pathology and oral medicine alone. And most of these questions, if you look at it, they will be like either clinical based or like image based. And some straightforward one-liner questions can also be asked from oral pathology and oral medicine. Okay. So, like I always used to say, after reading the question and the options, if you know the answer, you can put it in the chat box. If you are doubtful about an answer also, still you can put it in the chat box. And if you don't know the answer, you can put that you don't know the answer. Okay. Uh, I want maximum response from your side also. Okay. So, okay. So let's begin, doctors. So first question is, a girl child came with her father to the dental clinic for scaling. On intraoral observation, the dentist noted that her teeth were shaped like a carnivore. This type of teeth is called, okay, what is it called? Is it phylodont or haplodont or lobodont or carnodont? Okay, this question, uh, similar, mostly the same question appeared in the recent NEET MDS 24 exam. And usually from developmental disturbances, the topics that we usually focus are like the amelogenesis imperfecta or the dentinogenesis imperfecta or the dentine dysplasia or the regional or endodysplasia. All those topics are there. And these are some topics that we tend to overlook. Okay. But recently, in the recent NEET MDS exams, usually they were asking questions from these topics that we tend to overlook, or that what we tend to think like, okay, I don't think this is important. We can skip this for now, like that. The questions were asked from such topics in the recent NEET exams. Okay. So, it's like you should not skip any of the topics. Okay. So, yes, doctors, answers, please. What is the answer for this question? Yes, Dr. Saumya. Others? Dr. Farhana, Dr. Fida, Dr. Nandana. Answers, please. Okay. Any answers? If you don't know, then you can put it in the chat box like you don't know also. No, no issues, no judgments here. Okay. What is the answer for this question? Okay, Dr. Farhana. Yes. Okay. Haplodont. Okay. So the teeth that was shaped like a carnivore. Okay. Carnivore teeth means mainly they will be referring to like canines and premolars with a fang-like cusp. Okay. So that will be more like a carnivore shaped teeth. Okay. So that is the right answer for this question is option C, lobodont. Okay. I'll tell you what a lobodont or lobodontia is. Okay. So lobo is a Spanish word for the wolf. Okay, so wolf-like teeth or carnivore-like teeth are mostly seen in lobodontia. Okay, there's a specific term for that that is called as lobodontia. Now, In the lobodontia, almost all the types of teeth, that is the incisors, the canines, premolars, and the molars will be affected. And it is one of the rarest hereditary anomaly. Okay. The teeth will be shaped like a carnivores, especially the canines and the premolars. They will be shaped like, they will have like a fang-like cusp like this. Okay. Sorry. They will have a fang-like cusp like this, and their buccal cusp will be very prominent, and the lingual cusp will be very rudimentary. Okay, so this will give the appearance of like a fang-like cusp like this. Okay, mainly the canines and the premolars will be involved, and usually they will be like reduced in the size also. That is, hypodontia will also be seen in case of this canines and premolars. Now, other than this, the incisors can also be affected, which will show something like a shovel-shaped incisors will be there, and molars will also be affected. And the characteristic appearance of molars in this lobodontia is called as this multitubercular appearance. Okay, so this is the multitubercular appearance of the molars. You can see like globe-shaped cusp protruding from the molars. That is known as the multitubercular appearance of the molars. Okay, so another characteristic feature that you see in this lobodontia is that single conical roots for the posterior teeth. Okay, so this is the molars, which usually have like two roots, and these are the maxillary molars, which usually have three roots. But you look at it here. Okay, here it's just one single conical root for the molars, for the both the mandibular and the maxillary molars. Okay, so this is a characteristic feature of lobodontia. Okay, so lobodontia means it is also called as wolf teeth, and almost all the teeth will be affected in case of this lobodontia. It is a rare hereditary anomaly in which the human teeth will resemble like that of a carnivore. And usually it is inherited in the form of an autosomal dominant trait. Almost all teeth will be like reduced in size. Hypodontia may be seen, but most commonly the incisors will be usually shovel shaped, and the canines and premolars, they'll be like fang-like cusp will be there, and the molars, the typical multitubercular appearance, and the single conical roots will be seen in case of this lobodontia. Now, there is another pathology that is called as globodontia. Okay, you should not confuse between the two. This is globodontia, but there is another pathology also that is called as the globodontia. In globodontia, usually what we see is that the molars will be like proper globe-shaped molars will be there. And along with that, in most of the patients, there will be hearing loss also. Okay, so this globe-shaped molars together with the hearing loss, that is called as otodontal syndrome. Okay, so this globodontia is a part of this otodental syndrome. Okay, so do not get confused between this lobodontia and the globodontia. Both these pathologies are there in the developmental disturbances of the teeth, the first chapter. Please have a look in your textbook also. Now, next question. The tulip-shaped crown is a feature of which of the following condition? Yes, doctors, answers please. Tulip-shaped crown is seen in which of the following pathologies? Is it in Turner's hypoplasia or taurodontism or dentinogenesis imperfecta or amylogenesis imperfecta? Yes. Yes, Dr. Soumya. Yes, Dr. Farhana. Others? Dr. Fida, Dr. Rahul, Dr. Atira. Yes. Yes, doctor. Okay. Okay, so, okay. You all are right only. The tulip-shaped crown is a feature of dentinogenesis imperfecta only. Okay, so let's have a look at what you mean by this tulip-shaped flower. Okay, so in the tulip-shaped flower, if you see that this is the crown portion of the flower, and if you see this at this junction between the flower and the stalk, you can see that it is like severe constriction is seen. Okay, the stalk is like very thin, so a severe constriction here is seen. Okay, the same kind of teeth we can see in this dentinogenesis imperfecta also. The crowns will be usually bulbous, and like severe or marked cervical constriction is seen here. Okay, so that's why it is called as tulip-shaped crown. Now, what is this dentinogenesis imperfecta? So, dentinogenesis imperfecta is a hereditary disorder of dentin. Usually, the genes that produce the dentin will be affected, like the DSPP gene or the dentin silophosphoprotein gene, and COL1A1 gene and COL1A2 gene. Okay, this COL1A1 gene and COL1A2 gene are also involved in osteogenesis imperfecta, but dentinogenesis imperfecta means we are considering only the disorders of dentin without any systemic condition. Okay, that's important. We are not considering it part of a systemic condition. Dentinogenesis imperfecta, now we are considering it only without any systemic condition. Okay, like a separate entity, not along with the systemic condition. Okay, so usually the following genes are affected, and there are so many classifications given for this dentinogenesis imperfecta also. That is like Witkop's classification, Shields classification was all given. And recently, the accepted classification is the dentinogenesis imperfecta type 2 and type 3 are mainly important. The type 2 is the hereditary opalescent dentin, which is also called as Kapp-Dupont teeth. And the type 3 is the Brandywine type. Now, if you look at the clinical features, both the dentitions, the primary and the permanent dentitions will be affected, and there will be a discoloration of the teeth. Okay, characteristic discoloration like blue to brown discoloration is commonly seen, and this enamel easily gets separated from the dentin. Okay, since the dentino-enamel junction is not strong, this enamel, they easily get separated from the dentin, and in the radiographic features, okay, in the radiographic features only, you will be seeing the characteristic bulbous crowns, the cervical constriction, the thin roots, and the obliteration of the pulp. You can see here in this radiographic image here, no pulp chamber is seen here, right? So the obliteration of the pulp is seen in one form of dentinogenesis imperfecta. And in some cases of dentinogenesis imperfecta, what you can see is that there will be enlarged pulp chambers will also be seen. Okay, so such enlarged pulp chambers give an appearance that is called as the shell teeth. Okay, so tulip shaped crowns and shell teeth. Okay, both are characteristic features of dentinogenesis imperfecta. And histopathological features like an abnormal dentinal tubules, misshapen dentinal tubules, atypical granular dentin, and very few odontoblasts only will be seen, and lots of pulp stones will also be seen. Okay, but you should mainly focus on the clinical and the radiographic pictures, the tulip shaped teeth and the shell teeth. Very important. And the genes responsible. Okay, the DSPP gene and the COL1 genes are really important. Now, next question. A thistle tube shaped pulp chamber is found in. Is it found in dentinogenesis imperfecta type 2 or dentine dysplasia type 2, dentine dysplasia type 1 or odontodysplasia? Where is it found? Thistle tube shaped pulp chamber. Yes, doctors, answers please. Yes, Dr. Farhana. I think this question was already given there in the WhatsApp group also, right? Yes, Dr. Farhana. Others? Yes, Dr. Soumya. Okay. Others? Any other answers? Okay, Dr. Fida. Yes. All are right only. It is seen in dentine dysplasia. Okay. So what is dentine dysplasia? Dentine dysplasia is also a hereditary disorder of dentin, which is caused due to, like the type 2 is caused due to DSPP gene mutation only, dentin silophosphoprotein gene mutation only, this dentine dysplasia also. So what's the difference between this dentine dysplasia and dentinogenesis imperfecta? Okay, so like if there is a disease, that disease can show like the minimum amount of like clinical features and the maximum amount of clinical features. Okay, so it can be considered like a spectrum of disease. Okay, so in the spectrum of disease, there will be one low end and there will be one high end. Okay, so this dentine dysplasia, all those kind of hereditary disorders of dentin, they can be considered as the lowest end of the spectrum. Okay, because they show only like very minimal changes, mild changes. Okay, so that can be considered as the lowest end of the spectrum. And dentinogenesis imperfecta comes under the highest end of the spectrum. That is, it shows like the maximum deviation from the normal. Okay, so that is considered as the highest deviation, whereas this dentin dysplasia, it is considered as the lowest end of the spectrum. Okay, both are hereditary disorders of dentin. Both are caused due to the gene mutation, and in both cases, you can see like abnormal dentin also. Dentin dysplasia, it is like divided into type 1 and type 2, which we will be discussing here. So the type 1 is the radicular dentin dysplasia, or it is also called as rootless teeth. Okay, you can see the IOPA picture here. This is the characteristic example of the rootless teeth. Okay, you can see the dentin in the root area is not at all developed. So the root is not getting developed, and you can see like very rudimentary roots here. Okay, so that is the characteristic feature of type 1. Whereas in type 2, which is the coronal dentin dysplasia, that is mainly the crown portion of the dentin is affected. So in the crown, since the crown portion of the dentin is affected, usually clinically not much changes will be there. In case of the radicular dentin dysplasia, in the crown, if you look at it, not much clinical color changes will not be seen in the type 1. Whereas in type 2, there will be color changes seen in the permanent dentition or in the primary dentition. Either only one dentition will be affected. And another characteristic feature that you see in the type 2 coronal dentin dysplasia is this, the thistle tube shaped or the flame shaped pulp chambers. Okay, so this is the thistle tube, and the flame shaped pulp chambers is a characteristic feature of dentin dysplasia type 2. Okay, so this is a permanent dentition that is affected with this coronal dental dysplasia. You can see the color changes here, like yellowish to brownish color change is seen in the posterior teeth, whereas the anteriors are like mostly unaffected also. Okay, so uh, these are one of the clinical characteristics of this dentin dysplasia. Now, another characteristic thing that you see in the type 1 or the radicular type of dentin dysplasia, if you do a ground section of the tooth that is affected by the radicular dentin dysplasia, and you place it under a polarized light microscope. Okay, you should view it under a polarized light microscope. Then you will be able to see an appearance like this. Okay, you'll be able to see an appearance like this. This appearance is called as the stream flowing around the boulders or lava flowing around the boulders appearance. Okay, so what do you mean by lava flowing around the boulders or the stream flowing around the boulders means if it's a stream of river, if it is like flowing around the a big rocks like this, then that gives this stream flowing around the boulders appearance or the lava flowing around the boulders appearance. So these huge rock-like things that you see in the picture here, okay, they are the atypical dentin. Okay, they are the abnormal dentin that is formed in this dentin dysplasia, and this is the normal dentin at the periphery. Okay, so this normal dentin is appearing like it is flowing around this atypical dentin. Okay, so that is what giving this stream flowing around the boulders appearance or the lava flowing around the boulders appearance. Okay, so I think you are clear with the dentin dysplasia. Now moving on to the next question. Name the condition given in the image below, which is attributed to mutation in the ENAM gene and radiographically seen as the generalized thinning of enamel. Okay, so ENAM gene, where it is involved, is it osteogenesis imperfecta or amelogenesis imperfecta or dentinogenesis imperfecta or fluorosis? Yes, doctors, answers please. Where will you see ENAM gene mutation? Comparatively easy. It's from the name itself, it suggests. Okay, ENAM gene, which produces the enamelin protein. Yes, Dr. Huda, yes. Farhana, yes. It is amelogenesis imperfecta only. ENAM gene, it produces the enamelin protein, which helps in the formation of the enamel. Okay, so the enamel, the hereditary disorder of enamel is the amelogenesis imperfecta. Okay, from the clinical picture itself, you can see that there is discoloration of dentition. And another characteristic feature that you can see here is that no contact points. Okay, there are no contact points between the teeth. The teeth are very small, hypodontic, and no contact points between the teeth is seen. Okay, so these are all characteristic features of amelogenesis imperfecta. Okay, so let's have a look at amelogenesis imperfecta. Like the dentinogenesis imperfecta, the hereditary disorder of enamel, that is called as the amelogenesis imperfecta without any systemic condition. Okay, that is very important. Should not be included under any systemic condition. Okay, this is a particular entity. Amelogenesis imperfecta is the hereditary disorder of enamel without any systemic condition or any systemic disease. Okay, so generally, for the description types, there are like 4 types of amelogenesis imperfecta. One is the hypoplastic type, another one is the hypomaturation type, and third one is the hypocalcified type, and fourth one is the hypoplastic hypomaturation with taurodontism is also seen. Okay, so based upon the gene involved, okay, lots of genes are involved in this amelogenesis imperfecta, but the most common ones are the MLX gene, which will result in the formation of an X-linked recessive disease. Okay. And we have the ENAM gene, like we already mentioned, ENAM gene is there. Then FAM83H gene. Okay, very important gene. This involved in the amelogenesis imperfecta. If a person have some kind of mutation in this FAM83H gene, then definitely we can expect like 90% we can expect the amelogenesis imperfecta in this patient. Okay, then DLX3 gene, all the MMP20, kallikrein-4 gene are all involved. And one of the most important are these genes that are mentioned here only. So ENAM gene, what it does is that normally it produces a protein called as enamelin protein. Okay, and this will help in the uh, production of the normal enamel. Okay, but in case of some mutation happening to this enam gene, then what happens is that hypoplastic type of amelogenesis imperfecta is what is happening in case of some mutation happening to this enam gene. Okay, the hypoplastic type means the enamel matrix itself is not formed perfectly. Okay, the matrix itself is formed defectively. Okay, so that is the hypoplastic type. And you can see like very thin enamel, pitting of enamel, generalized pitting or localized pitting of enamel is all characteristic finding of this hypoplastic type of enamel. Okay, so just have a look at the genes that are involved in amelogenesis imperfecta and dendrogenesis imperfecta. They can ask questions on this too. Now, next is an image-based question. Which phenomenon is depicted in this radiograph? Very easy one. Yes, doctors, answers please. Is it fenestration or gemination or dilaceration or concrescence? What is seen in this radiograph here? Yes, Dr. Huda. Others? Yes. Yes, doctors. Yes. Yes. Dr. Fida. Yes. All are right only. It is dilaceration. Okay, very commonly seen. So what do you mean by this dilaceration? Dilaceration means an abnormal angulation or a bend in a tooth. Okay, this bend can be seen in the root portion mostly, but rarely in the crown portion also. Okay, so first let's have a look at the other options also. Okay, so the option A given was fenestration. What do you mean by fenestration? Means it is just the root which is only covered by the periosteum and the gingiva. Okay, and uh, uh, this thing I think you have studied in the perio very thoroughly. The marginal bone will be intact in case of the fenestration. Whereas in dehiscence, it is the same thing. It will be covered by periosteum and gingiva only, but the marginal bone is not intact. Okay, so the defect is extending through the marginal bone also. That is the main difference between this fenestration and dehiscence. So the first option that was given was fenestration. No, it was not there. Then the next second option that was given was gemination. Okay, so what do you mean by gemination? Gemination and fusion we will discuss later in one of the slides also. So gemination means it is just a single tooth bud which will divide and it will form a bifid crown with a single root and root canal. Okay, in more detail I will explain later. And if you look at the total tooth count, okay, if you look at the total tooth count, if you are considering the involved tooth as one, then the total tooth count will be normal in case of gemination. Okay, I'll explain the differences between gemination and fusion in detail. Now, the third option was the dilaceration, which we know it is the abnormal angulation or the bend in the root or crown of the teeth. And usually, why this bend is causing? Because during the tooth development, if there is any injury to the tooth germ, or because of the presence of a cyst or tumor, okay, during the developmental time, okay, because of the presence of a cyst or tumor is there, then what happens is that this tooth bud will angulate and will develop around the cyst or tumor. Okay, so that's why this sharp bend is happening. And most commonly affected tooth are the mandibular third molars. And this dilaceration is also associated with some syndromes. Okay, it is associated with Smith-Magenis syndrome, Ehlers-Danlos syndrome, Axenfeld-Rieger syndrome, and congenital ichthyosis. Sometimes they can ask questions like this also. The following condition is associated with all of the following syndromes except. Okay, at that time, you should know the syndromes also. Like this, the Talon's cusp is also associated with syndromes. Okay, you should know which all syndromes are associated with which all pathologies. Syndromes are really important. Minimum, like last exam and all, if you look at it, minimum 2 questions were asked from syndromes alone. Okay. So the complications of this dilaceration are like orthodontic treatment can get difficult, endodontic treatment can get difficult, and extraction also can be difficult if this dilaceration is present. The last option was the concrescence. Concrescence means it is the union of two teeth by the cementum. At the portion of the cementum, the two teeth will get joined. Okay. Uh, Without the confluence of the dentine. Okay, only the cementum is joined. The dentine is not joined in case of this concrescence. Now, moving on to the next question. Identify the anomaly shown in the image. Okay, is it gemination or fusion or concrescence or supernumerary teeth? Okay, you can see here. Identify this from the image. Yes, doctors, answers please. What can it be? Is it yes? Fusion. Okay. Okay, Dr. Soumya, Dr. Fida, others? Any other answers? Okay. Okay, Dr. Farhana. Any others? Other answers? Okay, so let's have a look at it first. Actually, the answer is option B, fusion. I'll tell you why. Okay. Let's have a look at the teeth that is present in the mandibular arch and count the teeth. Okay. So this is the molars, mandibular molars. 1, 2, 3, 4, 5, 6, 7, 8. Okay. So totally in a mandibular arch, we should have 10 teeth. Okay. So 2 teeth are missing. Okay. So the count is below normal. Okay. So that is a characteristic feature of fusion. And as you can see, 2 teeth are fused here. Okay, so this is a characteristic feature of like bilateral fusion of decidus mandibular incisors, mandibular lateral incisors with the canines. Okay, so that is what is shown here. It is the bilateral fusion of this decidus mandibular lateral incisors with the canines is shown here. Okay, so fusion means it is the union of two normally separated tooth buds. Okay, fusion means union. Gemination means division. Okay, you should not confuse between the two. Fusion means union of the two separated tooth buds, whereas gemination means it is the attempt to divide. Okay, so this fusion will result in the formation of a joint tooth at the dentine. Okay, so the dentine of the two teeth will be joined. And if you look at the tooth count will be usually less. Okay, if we take this tooth as 1, if we take the tooth, the abnormal tooth as 1, then the tooth count will be less in number. Okay, so most commonly seen in the Asian population, And most commonly, deciduous teeth are usually affected, especially the mandibular incisors and canines are usually affected in case of the fusion. And sometimes in the radiograph, if you look at it, you can see separated root canals. Okay. But that's not always a characteristic feature. In some cases only, we'll be able to see the separated root canals. In other cases, the root canals also will be joined. Okay, that depends. So this table is very important, the difference between the gemination and fusion. Okay, so gemination means it is the attempt of a single tooth bud to divide. Okay, a single tooth bud is attempting to divide with the formation of an enlarged tooth. Okay, you can see here it is attempting to divide and a large macrodont tooth is seen here. Fusion means it is the union of two separated tooth buds with the resultant formation of a joint teeth, and they are getting joined at the dentine. Okay. And gemination, the total count of the tooth will be normal. If you take the tooth, the affected tooth as one, still the total tooth count will be normal in case of the gemination. Whereas in case of fusion, it will be less than one. Okay, so that is one characteristic feature to divide to differentiate between gemination and fusion. And in gemination, usually single root and root canal are seen. Fusion, usually separated root canals are seen, but there are exceptions to this case also. Sometimes they can be single root canal can be seen. Gemination is more common in maxilla, whereas fusion is more common in mandible. Okay, you should remember that also. Now, moving on to the next question. Identify the following condition shown in the image below. Very easy. What is shown in this? Yes, Dr. Soumya. Yes, Dr. Huda. Yes, Dr. Fida. Yes, Dr. Farhana. Very easy. Okay. This is a classical example of supernumerary teeth, which is the mesiodens. Okay, so what do you mean by supernumerary teeth? It is an extra tooth that is present in the oral cavity, or an additional tooth that is present in the oral cavity. Now, there is like lots of classifications for the supernumerary tooth based upon the location, based upon the morphology, based upon the orientation, position, all divided. So based upon the location, it is divided into mesiodens. Okay, so this what is shown in the question image, that is the mesiodens. Supernumerary teeth that is seen between the two upper central incisors. That is the mesiodens. Then we can see something like this, the paramolars. Okay, just lingual side to the molars, you can see a supernumerary teeth like this. This is a classical example of paramolars. And we have the distal molars. Distal side of the molars, you can see an extra teeth like this. This is the distal molars and parapremolars. Sometimes in the mandibular arch, we can see on the lingual side an extra premolar erupting just lingual to the normal premolars. Okay, so that is called as the parapremolars. Now, these supernumerary teeth, they can take the shape of a normal teeth, or they can take another shape. Okay, so based on that, there will be like normal or the rudimentary supernumerary teeth are there. So the conic under the rudimentary section only, this conical, tuberculate, supplemental, and odontomes are all based upon the shape or based upon the morphology only. This classification is there. Then orientation, they can be usually vertical and can erupt into the oral cavity, or maybe inverted, or maybe horizontal. And we might be seeing it only on the radiographs also, not clinically. And based on the position, it can be seen in the buccal side, or in the palatal side, or in the transverse side. Okay, so these are the based upon the morphology. This is the classification of the supernumerary teeth. The most common one is the conical form. Okay, the mesiodens, the most common form of supernumerary teeth that we can see in our oral cavity is the mesiodens, which is usually conical shape. 75% of this supernumerary teeth are usually conical in shape only. Complete roots may be seen, most commonly seen in the anterior maxilla, and maybe erupted or maybe not erupted also. The second most common one is the tuberculate type. Okay, you can see this tuberculate type of supernumerary teeth. You can see barrel shape. Okay, it is completely like a barrel shaped teeth will be seen. Okay, usually seen in the anterior maxilla and only, and paired maybe. Okay, supplemental means this will be like that. It can take the shape of the normal teeth itself. You can see here the premolars here, the extra premolars that as you can see here, they are like similar in morphology to the normal premolars itself. Okay, in the mandibular or arch also you can see supplemental premolars like this. Then the odontomes like this. Okay, odontomes like small teeth like spicules will be seen here. Okay, irregular mass or irregular denticles will be seen in case of this odontome type. Now, moving on to the next question. What is shown in the image given below? You all know that this is a talus cusp, but is it a trace talon or true talon or complete talon or the semi-talon or the incomplete talon? Which type of talus cusp is shown here? Yes, Dr. Soumya. Yes, Dr. Huda. Yes, Dr. Fida. Yes, all of you are right. It is true talon or complete talon. Okay, because it is like passing above the middle third of the tooth. Okay, so it is the true talon or the complete talon. So talon's cusp is like an accessory cusp or an extra cusp that is usually seen in the lingual side of the anterior teeth. Okay, it can be seen in the maxillary teeth or in the mandibular teeth also. And this extra cusp, they'll be shaped like the eagle's talon. Okay, so that's why it's called as the talon's cusp. And the classification for this talon's cusp was given by two persons. One is Heta Batal, and he had classified it as like true talon, semi-talon, and trace talon. Okay, so true talon means it extends half or more than half of the distance from the cemento-enamel junction to the incisal edge. Okay, if half or more than half of the distance is covered, then it is a true talon. Semi-talon means less than half of the distance from the cemento-enamel junction to the incisal edge. Okay, only less than half the distance is covered. Trace talon means it is just like an enlarged or prominent cingulum like this. Okay. Just like an enlarged or prominent cingulum is seen in the cervical third alone. That is called as the trace talon. Now there is another classification which was given by Melignani et al. So according to this classification, this based upon the position of the talus cusp. Okay, you can see the talus cusp in the buccal area also, in the labial area also, like this. You can see here. Okay, so there is something like a facial talon, and then there is the lingual or the palatal talon. Okay, and then both the types, or facial and lingual or palatal, both the types are seen. Okay, so that are the three classifications that are given. Now, this talon's cusp is usually associated with a syndrome, which is called as a Rubinstein-Taybi syndrome. Okay, syndromes you should not forget. It is called as the Rubinstein-Taybi syndrome. Now, next question. Identify the lesion shown in the image below and the disease associated with it. So what is shown here? Is it strawberry tongue in scarlet fever, or raspberry tongue in scarlet fever, or Pasteur spots in scarlet fever, or Fukushima spots in scarlet fever? What is seen here? Yes, Dr. Soumya. Others? What is it? Is it strawberry tongue or raspberry tongue or Pasteur spots or Fukushima spots? Yes, Dr. Farhana. Okay. So what is shown here is you are right, it is strawberry tongue in scarlet fever. Okay, so what do you mean by scarlet fever or scarlatina? Okay, it is caused due to the bacteria group A beta hemolytic streptococci. Okay, this mainly caused due to the bacteria, the beta hemolytic streptococci. Now, when this streptococci, it attacks the human beings, usually the incubation time it takes is usually like 1 to 7 days. And most commonly, the children are affected. Around the 3 to 12-year-old children are most commonly affected. And you can see three types of clinical manifestations. Okay. One is the fever, and then the exanthem. Okay. Skin rash on the exanthematous rash will be characteristically seen. And the ananthem. Okay. In the oral cavity, if you look at it, there will be like pharyngotonsillitis. The tonsil will be enlarged, pharyngitis will be seen, and sometimes like an exudate on top of the tonsil can also be seen. Okay, so fever, it will start from the second day onwards and it gets normal within 6 days. And there will be like abdominal pain, headache, malaise, nausea, vomiting. All the features will be seen. All the features of an infection will be seen. Exanthematous rash. Okay, it usually appears in the first 2 days and spreads within 24 hours. If you look at this rash, it is characteristically called as the sunburn with goose pimples. Okay, the characteristic appearance of this rash is the sunburn with goose pimples. That is called as the characteristic appearance of the scarlet fever rash. And if you touch and feel it, it will something feel like a sandpaper like texture will be there. Okay, very rough sandpaper like texture will also be seen in case of this scarlet fever. Now, what do you mean by pasteurlines? Okay, so this is a characteristic appearance of this pasteurlines. Pasteurlines means in the fold region. Okay, in the skin fold region, you'll be able to see like red vertical streaks like this. Okay, so these red vertical streaks that you see in the scarlet fever, that is called as the pasteurlines. And oral cavity. Okay, very important changes that are happening in the tongue. Okay, so initially you'll be able to see the tonsillitis, pharyngitis, and all. The swollen tonsils will be characteristically seen. Then, like as days pass, what happens is that the tongue will be coated with a white covering. Okay, so the tongue will be coated with a white covering, and the fungiform papillae. Okay, the fungiform papillae, they will be swollen and they will appear like very bright red in between this coating. Okay, so that is called as the white strawberry tongue. Okay, so this is the characteristic clinical feature of a white strawberry tongue. Okay, so the tongue will be covered with a white coating and the fungiform papillae, they'll be like very inflamed and they'll be red in color and they will appear out from this white coating. These red fungiform papillae will appear in contrast. Okay, so that is called as that appearance is called as the white strawberry tongue. Now, like another 3 or 4 days later, what happens is that this white coating, it will get removed. Okay, so the white coating will get removed and the whole tongue will appear like very reddish and swollen in color. Okay, so that is called as the red strawberry tongue, or it is sometimes it is also called as the raspberry tongue. Okay, so this is how a raspberry tongue looks like. Okay, the fungiform papillae will be like very inflamed and totally red in color. Okay, so that is the sequelae of the tongue changes. Usually, the first seen change is the white strawberry tongue. Then it will get converted into the red strawberry tongue, which is also called as the some others. Okay, some others they call it the raspberry tongue also. And all these skin rashes they usually clear within 1 week. Okay, so moving on to the next question. Kissing lesion is. Okay, so what is called as kissing lesion? Is it benign migratory glossitis or hairy tongue or benign or median rhomboid glossitis or infectious mononucleosis? Yes, Dr. Soumya. Others? Yes, Dr. Huda. Yes. Yes, Dr. Fida. Yes, Dr. Farhana. Yes. You should not get confused between kissing lesion and kissing disease. Okay, kissing lesion is median rhomboid glossitis only, whereas kissing disease is infectious mononucleosis. Okay, there will be so many terms like this which are like closely related in pathology and medicine. Uh, Write down these terms in a particular notebook that you have or make it like a sticky note and have a look at it like every day or weekly. Okay, so that you don't get confused between these two terms. And there are so many appearances also, like the eyes towards seven appearance or the ground glass appearance or the strawberry appearance of the gingiva. Like that, so many appearances will also be there. Write down these in a separate notebook and have a look at it periodically. Okay, so that's a one way to study this and to remember it. Okay, so let's have a look at the kissing lesion. So the median rhomboid glossitis, which is also called as the central papillary atrophy of the tongue. Okay, just like the clinical feature, there will be like atrophy of the tongue in the central portion, which will be usually rhomboid in shape. Initially, it was considered as a developmental disturbances. Developmental disturbance. Okay, it is some kind of a developmental disturbance of the tongue. But later on, like they had conducted so many studies and they found out that it was not a developmental disorder. It is a lesion that is associated with candida. Okay, candida albicans. Okay, so candidiasis, there can be of two types clinically. One is the pseudomembranous type and other one is the erythematous type. Okay, so this median rhomboid glossitis, it comes under the erythematous type of candidiasis, which is a chronic one. Okay, there is acute one also, which is the antibiotic sore mouth, and the chronic type of erythematous candidiasis. That is this median rhomboid glossitis. So at the center of the tongue, you'll be able to see something like a well-demarcated rhomboid-shaped erythematous zone that is affecting the midline of the tongue. There'll be no piliform papillae in this particular region. Usually, it will be asymptomatic. Not much difficulties or complications will be there for the patients, and they will be symmetrical, maybe smooth, but sometimes they can be lobulated also, like a central raised area may be seen. Okay. Now, because of the constant contact between the tongue and the palate, okay, what we can see is that the same lesion can be seen in the palate also. Okay, why? Because of the constant contact between the tongue and the hard palate, this same lesion can be seen in the palate also. That is called as the kissing lesion. Okay, so treatment is mainly antifungal therapy. With antifungal therapy, it will be cleared in very few days. Okay. Now, next question. A patient comes with emotional problems, increased salivation, pallor of oral mucosa, and grayish blue discoloration of the gingiva. These findings are most consistent with a clinical impression of what can be the cause for these clinical symptoms. Is it due to cherubism or cretinism or Pair-Robin syndrome or lead poisoning? What do you think? Yes, Dr. Fida. Okay. Okay, Dr. Saumya, Dr. Huda, Dr. Fida, yes. Dr. Farhana, yes. It is lead poisoning. Okay, so let's have a look at what lead poisoning is. Okay. So lead poisoning is also called as plumbism. Okay. Initially, because of the industries that manufacture paint, or like people who are working in the industries that manufacturing paint, or like lead batteries, or like cosmetics. Okay, such people are most commonly prone to this lead poisoning. And if you look at it, there'll be like acute clinical features of plumbism can be seen, and the chronic features can be seen. The acute features usually like abdominal colic will be seen, fatigue, irritability, weakness are all very commonly seen in the acute case of plumbism. Chronic cases, there will be like dysfunction of the nervous system, musculoskeletal pain, and headache will all be seen. These lead particles, they have an affinity for the hard tissues of our body. Okay. They mainly go and sit in the hard tissues of the body, mainly the teeth and the bones. So this is an X-ray that is taken of a boy. You can see this radio opaque line that you see in this bone. That is a characteristic feature of this plumbism only. Now, if you look at the oral cavity, you'll be able to see a line in the gingiva. Okay. In gingiva, in the oral mucosa, and in the tongue also, you'll be sometimes be able to see, but most commonly seen in the gingiva. Okay, so this line is called as the Burtonian line. Okay, Burton line or the Burtonian line, you can call it. Okay, so why this Burtonian line is causing? Because in our oral cavity, there are like so many bacteria, normal commensals of the oral cavity are there, which are the common bacteria. So these bacteria, they will produce something like the hydrogen sulfide. Okay, so these lead particles, when they combine with this hydrogen sulfide, it will produce something called as the lead sulfide. Okay, so this lead sulfide is what is producing this color in the gingiva. Okay, and ulcerative stomatitis, grayish discoloration are all very commonly seen in lead poisoning. Now, this line in the gingiva is seen in one other form of toxicity also. Can you tell me, like, in which other toxicity you will be able to see a line in the gingiva? Yes, doctors. One is the lead poisoning, which is the Burtonian line. In another metal poisoning also, you will be able to see a like mercury. Okay. One is mercury and another one bismuth. Yes, Dr. Farhana. In bismuth poisoning also, you will be able to see a characteristic line like this in that is like very much similar to the lead poisoning. Okay. You'll be able to see something like very much similar to lead toxicity in the bismuth poisoning also. Okay, you should remember that. Now the treatment, ethylene diamine, the main treatment is EDTA and dimercaptopropanol. Okay, so these are the two drugs that can be given in case of the lead poisoning. Now, moving on to the next question, identify the lesion shown in the given image. What is this? Yes. Yes, Dr. Soumya. Yes, Dr. Huda. Yes, this is a characteristic fold-like appearance in the maxillary alveolar region. Yes. And note that the patient is edentulous. Okay, so definitely he'll be wearing a denture. Okay, a CD patient. Okay, so this is option A, Epulis fissuratum. Okay. So what do you mean by Epulis fissuratum? Epulis fissuratum is also called as inflammatory fibrous hyperplasia or the denture epulis or the denture injury tumor. Okay. Epulis is a like an umbrella term. Okay. It's like a broad term which we can use for any swelling in the gingival area. Okay. So epulis is like a broad term. So this Epulis fissuratum means usually we'll be able to see in clinically like single or multiple folds of hypoplastic tissue will be seen, especially in the anterior region. Okay, maxillary anterior region, you will be able to see such forms of hypoplastic tissue and uh, mostly it will not be producing any discomfort to the patient, but in case of any secondary changes like any ulcer or bleeding is there, then only the patient will notice this maybe. Okay, and most commonly seen in the denture wearers, like around 5 to 10 year of denture wearing patients. There'll be history of denture wearing for this patient. And sometimes secondary changes can also be seen. If you palpate this Epulis fissuratum, it will be usually like firm and fibrous only. Okay, it will be firm and fibrous. And histopathologically, if you look at it, just if you excise the whole lesion and if you look at it, normal features will only be seen, like the connective tissue, lots of fibers and lots of blood vessels and inflammatory cells can be seen. Epithelium can be hyperkeratotic, like long epithelium can be seen, and rarely you might be seeing like osseous and chondrous metaplasia in the underlying areas. Okay, but that's commonly not seen, but rarely you can see. Now there is another thing like leaf-like denture can also be seen. Okay, so this leaf-like dental enlargement can also be seen in the palatal area. Okay, so that is also commonly seen in this denture wearers. So what you can see is that leaf-like enlargement of the palatal mucosa are seen. Okay, if you look at the edges of that enlargement, it will be usually serrated in appearance or like that. So that is another form of this Epulis fissuratum. Now moving on to the next question. A patient complains of pain and redness all over the mouth after using the new toothpaste few days back. Which of the following is the treatment of choice for this patient? Is it topical beclomethasone or antifungal agents or triclosan or antibiotic administration? What can be the cause? Okay, so uh, patients can have, yes, Dr. Soumya, yes, Dr. Huda. Okay, so patients can have allergy to some of the contents in the toothpaste. Okay, like usually patients will have some allergy, like the cinnamon allergy, or because in case of like if we after the dental treatment, okay, if they are allergic to some kind of the paste or the some kind of impression material, okay, that can also be seen like a mucositis. Okay, an inflammation of the mucosa can be seen. Okay, so here the answer is option A, topical beclomethasone only. It is a topical corticosteroid. The other option B, it is an antifungal agent, which is not preferred. Triclosan, again, it is a topical antibacterial, which is not preferred. Antibiotic administration is also not preferred. So this allergic contact stomatitis. Okay, so that is called as this allergic contact stomatitis. In case of like if we are exposed to the oral cavity is exposed to some kind of food like the I had already mentioned the cinnamon, or because of some kind of additives in the food, or because of some restorative materials, or the chewing gums or candies or some kind of denture material, or the like the toothpaste and mouthwashes, some kind of content in any of this compound, what it can cause is that it can produce a type of mucositis which is called as the allergic contact stomatitis. Okay, usually we'll be seeing this kind of reaction very immediately after the use of the agent. Okay, so this is also called as the stomatitis veninata. Okay, so the stomatitis veninata is another name for this allergic contact stomatitis, and mostly we had seen like the females getting affected with this, and there are two types, the acute and chronic forms are there. Burning sensation, okay, that will be the characteristic symptom of this patient. Burning sensation will be there. Erythematous areas, vesicles, erosion or ulceration can be seen. In this case you can see like an erythematous area, and there is like a the mucosa is getting peeled off here. Okay, this whitish peeling of the mucosa is also characteristically seen. Okay, so in case of a toothpaste allergy, you'll be able to see widespread reddish color with desquamation of the overlying epithelium will also be seen. Like the peeling of the overlying epithelium like this can also be seen in case of a toothpaste allergy. Okay, so the treatment for this patient is, the first is removing the agent that is causing this problem, and then we can give the antihistamine, topical antihistamine, and topical anesthetics can also be given. In case of chronic cases, we can give the topical corticosteroid gel also. Okay, so that's why in the options that are given, we had chosen the beclomethasone because it is a topical corticosteroid agent. Okay, so I hope that's like too much pathology for today. We'll definitely see in the next class. In case if you're having any doubts, you can ask now. Or if you don't remember the doubts, then you can ask in the WhatsApp group, or you can DM me personally also, or you can put it under the chat box under this video also. We'll definitely answer it. Okay. So I hope you are all are able to follow with the schedule. There's a little bit change that we had made for the schedule because this oral pathology and oral medicine are like really important subjects. So you should keep revising that before the exam. That's why we had preponed the oral pathology subject to before the general surgery. Okay. Any doubts, doctors? Okay. Okay, if you don't remember the doubts now, you can ask in the WhatsApp group, or you can DM me personally also, or you can put it under the chat box under this video. Okay. So all the best for your preparations, doctors. Do well. Thank you so much for attending the session. All the best for your progression. Do well. Okay. Good night. Bye.